Safety reporting within the ABBRUPT trial. The definition of a serious adverse event is any event, adverse reaction or unexpected adverse reaction that results in death, is life-threatening, requires hospitalisation or prolongation of existing hospitalisation, results in persistent or significant disability or incapacity, or consists of a congenital abnormality or birth defect. All adverse events must be recorded in the participant's medical notes. SAEs within the ABBRUPT trial are paper-based, and a copy should be emailed to the ABBRUPT trial office within 24 hours of site knowing of the event. Adverse events and expected serious adverse events are recorded on the follow-up CRFs. Unexpected SAEs that require expedited reporting will be recorded on a serious adverse event form and securely emailed to the ABBRUPT trials team within 24 hours of site knowing of the event. BCTU will then report SAEs to the DMEC and REC as appropriate. An adverse event is any untoward medical occurrence in a patient or clinical trial subject administered a medicinal product and which does not necessarily have a causal relationship with this treatment. An adverse reaction is an untoward and unintended response to an IMP related to any dose administered. A serious adverse reaction is an adverse reaction that also meets the definition of a serious adverse event. Unexpected adverse reactions is an adverse reaction, the nature or severity of which is not consistent with the applicable product information. When the outcome of an adverse reaction is not consistent with the applicable product information, the adverse reaction should be considered as unexpected. A suspected unexpected serious adverse reaction, or a SUSAR, is when the nature or severity of the event is not consistent with the applicable product information. A SUSAR should meet the definition of an adverse reaction, unexpected adverse reaction, and a serious adverse reaction. An unexpected event is the type of event that is listed in the protocol as an expected occurrence. An unexpected event is the type of event that is not listed in the protocol as an expected occurrence. There are some SAEs that do not require expedited reporting. These are hospital admissions that are less than 24 hours and pre-planned hospitalisation. The frequency of SAEs in this patient population may be high. Many of these SAEs will be anticipated and as such have been protocol defined as expected. These expected serious adverse events do not need to be reported to the ABBRUPT trial office on an SAE form. They should instead be reported on the follow-up forms and documented in the patient's medical notes. In summary, SAEs that do require expedited reporting on an SAE form are hospitalisations for serious adverse events not listed as expected in the protocol, death if not related to the underlying cause of ICU admission, and pregnancy if applicable. Those outcomes that do require an expedited SAE in pregnancy are detailed on the pregnancy notification form. So SAEs requiring expedited reporting, please document in the patient's medical notes and complete an SAE form and email the trial office within 24 hours. So again, if the event is serious but listed in the protocol as expected, report it on the follow-up CRFs. If the event is serious and not listed in the protocol as expected, complete an SAE form and email it to the ABBRUPT trial office. BCTU will then inform the DMEC and REC as appropriate. Pregnancy is very unlikely in this patient population. As pregnancy is an exclusion criteria, women of childbearing age should be tested for pregnancy as part of routine care upon admission to ICU. However, if this is not performed, we will require evidence of how you intend to monitor and/or confirm this. If a participant does become pregnant between randomisation and the end of the follow-up period, the patient must be withdrawn, a pregnancy notification form completed, and if applicable, an SAE form completed. The sponsor is responsible for notifying the REC of any serious breach of the conditions and principles of GCP in connection with the trial. Sites must notify the ABBRUPT trial office of any suspected trial-related serious breach of GCP and/or the trial protocol as soon as it becomes aware of them. Sites must provide sufficient information to report the breach and engage with undertaking any CAPA. Sites may be suspended from further recruitment in the event of serious and persistent non-compliance with the protocol and/or GCP and/or poor recruitment. If you are ever uncertain as to whether or how an adverse event or potential serious breach needs to be reported, please contact the ABBRUPT Trial Office for assistance.